Good afternoon, good afternoon. This is Dr. Velma Scantlebury, and I am the medical consultant for Dialysis Patient Citizens Education Center. And we are here this afternoon on April 15th, Task Day, to talk to you about anything you want to talk about. And I hope there's an opportunity to engage with the audience, and I look forward to those who are coming on board for us to talk about events that occur in April. Again, it is Facebook Live with the Dialysis Patient Citizens Educational Center. I was going to say Delaware. And I am Dr. Velma Scantlebury. So we are here this afternoon, and I hope that many of you would join, and we can discuss topics of your choice, but also note that this is National Donate Life Month. And in April every year, there's an opportunity to highlight donors, to talk about how to go about finding an organ donor, even whether it's living donation, hopefully, or even deceased donors. So thank you, Arthur Hill. Good afternoon. I'm Dr. Velma Scantlebury. I am the medical consultant for Dialysis Patient Citizens Educational Center. And this is our afternoon. Ask the doctor. And I hope you are having a wonderful day wherever you are. Maybe you can put in the chat where you're located. I am in Delaware, actually Wilmington, Delaware, Newark, Delaware, and that is right below Pennsylvania. And if you remember, this is where our former President Biden lives and continue to live. So thank you for coming on. If you have any questions to pose for today, let me know. But this is April, where we celebrate organ donation, National Donate Life Month, and it's also National Minority Health Month. And the goal is really about awareness and education, to be able to bring more understanding about taking care of yourself, understanding what are your risk factors, advocating for yourself and your family, as well as thinking about how you can really educate your community around those diseases that are most prominent, and allow for people to, your constituents, your family, your friends, to understand the importance of taking care of themselves. And so when it really is about awareness and understanding. If you're going to the doctor, no matter what your disease process is understanding how it affects you, what your outcomes are, what your choices are as far as treatment, and being aware of those. If you're limited in your understanding, then likely it may be that you're not aware of what your healthcare providers are failing to tell you. So you want to understand what your choices are, and whether or not those choices or one of those choices is appropriate for you. And that's why it's so important to have that understanding, have that education, and being able to ask questions. So we talk about, as this is April, Donate Life. If you've had a kidney transplant and have benefited from the donation of someone else, whether it's a living donor or whether it's a deceased donor, someone actually gave you an opportunity to have the gift of life. And that is so very, very important. So if you have had the transplant, I hope you are reaching back to your donor family. If it's a living donor, offering your gratitude. If it's a deceased donor, sending a thank you letter to the donor family, even if they don't answer back immediately. For some donor families, they they may not correspond back, but it's important to continue reaching out, sending those cards, sending those letters to really show your appreciation for organ donation. So oftentimes families donate and they never hear back from those recipients who receive their loved ones' organs, and they often wonder what happened to them. You know, did the organs work? Did it survive? So that's an opportunity to bridge that gap. So for those of you who just joined, I am Dr. Velma Scantlebury. I'm the medical consultant for Dialysis Patient Citizens Education Center, and we are here with Ask the Doctor questions. Thank you all for coming on, and Jennifer and Melissa and Janie, thank you for coming on. If you have any questions, please post them in the chat. Again, we are here. Remember, April is National Minority Health Awareness Month, as well as National Donate Life Month. And if you have not visited the website, either Dialysis Patient Citizens Education Center, where you can gain a whole lot of information on what's going on. Also, the National Donate Life website also gives you a lot of information. So if you're on dialysis and awaiting a transplant, please let me know in the chat. If you've had a donor, had a kidney transplant, then there's also a lot to be thankful for. So, okay, sorry about that. Getting a call from someone. An individual is, can they get, individuals on remission from cancer, can they get on the transplant list? For anyone who's had cancer before, you will need to get a bill of clearance from your oncologist, depending on the type of cancer or depending on the stage of that cancer. So it is important to understand whether or not if your cancer was a stage 1 or 2, is likely that you can undergo, whether it's chemotherapy, radiation, or even surgery, and still become cancer free. But it all depends on your cancer and stage. So if you are in remission and you've gone through that period that's required by your transplant center, which can be anywhere from 2 to 5 years, depending on the type of cancer, with the understanding that your risk to recurrence is due to, one, the type of tumor you had, but also you are now going to be on immunosuppressive medication, which dampens your body's response to fight not only rejection, but to fight any potential cancers. So you will still need to be monitored, and as long as your transplant center say there's very minimal risk for recurrence, you can be listed. Again, it depends on the type of cancer, your treatment, and the stage as well. A person on dialysis is afraid to travel. How can they be encouraged? Again, it depends on the dialysis and your travel, how long and where you're going. If you are on dialysis and you're just going for a day or two, you may be able to do that without needing to set up dialysis in another location. But if you are traveling for a length of time, remember you have to discuss that with your healthcare provider. Make sure that if it's more than 3 to 4 days, depending on whether it's peritoneal dialysis or hemodialysis, you may be required to find a location, if it's hemodialysis, in-center, to get your dialysis performed while you are in a different location. If you are on PD, you may be required to have your equipment shipped to where you're going, depending on the length of time you will be there, so that you can perform your dialysis. But there's really it just takes a little planning, but you definitely have a way of traveling. There are now different opportunities for people on dialysis. There may even be cruises for patients on dialysis. And as Michael said there, there's lots of possibilities. And if you have a dialysis machine, you can, if it's small enough, you may be able to, you travel with that, depending on your supplies, can be mailed ahead of time for you. So yes, there is ways to do that. And so you can talk to your providers about how you, where you're going, how long you're going to be. In-center dialysis will require you to find a unit that will accept you as a transient, so it may require some work on your part. And if you have family in the location you're going, then perhaps they can also assist you with what units you can be approved at. So thank you so much. If you're approved to be a living donor with one hospital, would you need to be tested again to be approved by another location? Generally, most of the routine tests that are done, whether it's cardiac, the bulk of the tests can be forwarded to the second transplant center. Each individual center will do their own HLA or your genetic typing and the cross match. They will accept an initial cross match done by another center, but they will do their own genetic typing. They will redo that, and they will redo your cross match with a donor, at least to make sure that you are not going to be at risk for rejection. So there's an element there where they want their own typing and to have it within their own system. And so most of the other tests, whether it's your echo, workup, cancer screening, all those things are generally accepted by the second hospital. So you will not have to repeat the bulk of your testing. Any scans generally are accepted also. We have traveled with PD, we've traveled with dialysis. We're doing a cruise in December, and we're taking our dialysis machine with us. Well, that is wonderful, Michael. Definitely the way to go. You want to be able to enjoy your vacation time, your opportunities to visit others and visit other places. So don't be afraid to get out there and go places. Just work it out with your dialysis center or your nurse, and have them make sure that you take the necessary things that you need to go. We heard a great deal about sepsis. How can it be prevented? Generally, sepsis is when the bacteria from any site externally has entered into your system and has done more damage than what we call bacteremia. Bacteremia is when your blood cultures are positive because you're showing the presence of bugs in your blood. Sepsis occurs when those organisms and then enter into your organs and begin to inflict damage. So you want to be careful with your sources of infection from the outside, whether it's a catheter, like a PD catheter, which is why when it's placed, there is a double Velcro to prevent bugs or skin bacteria going from the skin to the inside tract. And then there's a second barrier as it enters your peritoneum. So some patients may get exit site infection, and you want to treat that before it gets into your peritoneum, which can then cause bacteremia and get into your bloodstream, which can then cause pneumonia, low blood, hypotension, worsening cardiovascular disease, depression, so that you then have to go to the ICU. That's when your body is then totally overcome by all the bacteria, and your body is then reacting to the presence of those organisms, which make you very sick, and some can have severe respiratory compromise, needing to be intubated, and low blood pressure, needing multiple medications. Certainly for those with access, whether it's I know a lot of folks like to keep their neck access when they have a line in, but it's a risk of infection, and sepsis is very high. So I know you don't want to be stuck in your arm, but these catheters, there is not much room to go from the skin into the bloodstream, and there's a very high rate of sepsis with dialysis catheter, tunnel dialysis catheters, or catheters in your neck. and your hemodialysis sites. Basically, the grafts, AV grafts as a foreign tissue, will often have more risk of infection because of lack of bloodstream there. So you want to be careful with your dialysis sites as well. Dialysis can be very depressing at times, especially with life changes. How can one be happier and not depressed? Well, that's a difficult topic because you're dealing with a disease that certainly you want to have a positive outcome. And if you're going to dialysis day by day, it is oftentimes, I wouldn't say normal, but depression is often seen because you're not in control of your life anymore. You're stuck on this machine. It's the same process day after day, and you want to be happier. You may, for depression, it's an illness, just like heart disease. And so you may need medication to help you rise above that depression. You may require therapy in terms of seeing a therapist, a counselor, group therapy, just to know that you're not alone, to be able to talk through those issues, and oftentimes find ways outside of your own little pocket of what you do to interact with other people. We know that when you get depressed, you tend to go into isolation. You don't want to be with anyone, but it's really about how do we stimulate your hormonal output to make you, so you can get more serotonin output, so you can get those happier hormones. What makes you feel good? Those feel good hormones get you to a state so that you can be happier and at least lift yourself up by becoming more engaging. And so it's okay to know that it's okay to be depressed, but you want to be able to seek help for it, whether it's therapy, whether it's counseling, whether it's medication, or a combination of the above. And even the many of us who are not on dialysis will need a therapist, so you're not alone. Should a dialysis patient consider pregnancy? It will be a tough one because with dialysis, your hormonal balance is going to be abnormal, and certainly it's a risky time to be pregnant because with end-stage renal disease, you may have significant growth retardation. Many people are not able. It certainly will be a high-risk pregnancy if you're able to conceive. So generally, some patients who are on dialysis will not even be able to ovulate or get pregnant at all. But if you do, you have to seek GYN, knowing that there will be a high risk. How do you dialyze or go through dialysis with a pregnancy to full term? It's a very difficult situation if it happens, and so there can be definitely faced with multiple complications. Now, so talk to your GYN if you're considering that. It's not an easy task, and you will require significant monitoring to get through that pregnancy without any significant complications. Again, I'm Dr. Velma Scantlebury, medical consultant for Dialysis Patient Citizens Education Center, and we are here with Ask the Doctor questions. Thank you all who have joined. Nancy, thank you for all those questions, and all those who are watching. If you're here as a first time in the audience, please add it to the chat so we can say welcome to all of you who are new, and I hope you come back again. If you have any questions, be sure to post them in the chat so we can keep this going. Remember, as I said earlier, this is April. It's National Donate Life Month. You will see a lot on the various websites, whether it's the dialysis website, whether it's Donate Life America, whether it's the Kidney Foundation, and also on a DPC site where they talk about the importance of advocacy, the importance of education, knowing your choices, knowing your risk factors, and as well as advocating for others. So it's if you're had the fortunate gift of kidney transplant, then you know the importance and the significance of organ donation. If you're waiting for a transplant, you know your life is dependent on finding a kidney from someone, either a donor family who agrees to organ donation, or a loved one, friend, or other who is just willing to donate one of their kidneys. So thank you all for watching. Thank you all for being there. And so we said, Nancy has a question: infiltration during treatment. Are patients most of the time able to go for their next treatment? Again, like I said, when it depends on, okay, if your site infiltrates, that means that your needles have gone beyond your dialysis access, either piercing either your AV fistula or your AV graft. And so what that means is that this high rate of blood flow is going to go beyond your dialysis access into your subcutaneous tissue. And depending on how and when the pressure is applied after it infiltrates will depend on how much of a disruption you will have to the area. So just imagine that if it's caught early and pressure is held, and that site is then allowed to occlude by platelet formation, and so now you form a blood clot and there's no more leakage, then it may be that you may be able to, in 2 days when you come back, if you're on center dialysis, to be able to be able to insert that. But if there's a significant hematoma, and so again, it's the location, the site, the amount of blood loss, and the amount of hematoma there. But oftentimes you may have to avoid that location to prevent the risk of infection and have the needles be placed in a different site. So that's something you want to, if you're in center, they will try to navigate that course. If it happens at home, then you want to talk to your provider about what you should do with them assessing that location. Every time there's contamination, then there's always a risk of infection. So those are things you want to be careful about. So remember, those are not my area of expertise, but I'm going to give my best judgment. Thank you, Dorothy. I appreciate it. It's always a pleasure listening, watching, and learning from you. Education is key. Jennifer says, I'm a kidney recipient, 10 years. Congratulations, an ambassador with Donate Life. What an opportunity to be able to help others. Thank you so much for all that you do. Learning, forever grateful to my donor and the family giving me a second chance of life. It really is important to be able to do that. And if any of you have ever had an opportunity to go to the transplant games, please do. Because it's one of those phenomenal experiences that you will never forget, both in terms of being able to see the many recipients who were able to receive the gift of life through transplantation, but also the donors and donor families who come and give their heartwarming stories about donating organs and what they've gone through, and the relationship that can be built by those who attend, meeting the donors for the first time after corresponding for many years. So if you are a transplant recipient and have not attended a transplant games, please try to go to one. Because transplant is not a cure, what is the average for a transplanted kidney to endure, to live? Again, it depends on the age of the donor, the age of the recipient, and like I say, how well that recipient body accepts that donor kidney. I usually compare kidneys like a car. You can buy a new car, have it last many years, 10, 20 years without any issue. You can buy a new car and have it not last 5 years because you got into an accident over and over again and things happened, the engine wasn't bad, you got a lemon. You can also get a used car and still get 10, 15 years out of it because it was well taken care of. It didn't have any underlying issues. And so it goes the gamut. So the biggest thing is one, compatibility in terms of what are your risks of developing rejection. If you have not had any rejection, you can usually have pretty easy many years out of life out of that kidney. When you can have one episode of rejection and still get many years out of that kidney. So I would say the average for a deceased donor kidney is about 8 to 10 years. Some people get 5 years out of it, some people get 10, others get 15, and so it's a bell-shaped curve. If you have a donor who may be 50, 60 years old, it certainly may not do as well as a donor that's say 20 years old. But if you are 65 years old, your life expectancy for that older donor kidney may be good enough for you. So those are things you take into consideration. It's not a cure, but the goal is, how do I get you off of dialysis? How do I get your cardiac status improved now that you have kidney function, even if it's not perfect? Now we're able to get that fluid off of you because the kidney is working, and you're not going to go into congestive heart failure. And we can optimize your heart status, which is most important, because now I can get you to urinate more and to get to a euvolemic state. So those are things taken into consideration. Certainly it's not as easy as, my saying, certainly everyone wants a 20-year-old kidney or a 30-year-old kidney, but there are those organs which are older that may be appropriate for those who may not have a 30, 40 year expected life and may just be fine for them and serve them. I've had patients who had a creatinine of 2.5 to 3 with the kidney transplant, not great, but you know what? They kept that kidney for 10, 12 years. That was all they needed, and it didn't end up losing that kidney. So thank you. If you do not use your fistula, will it stop working? I've had patients keep their fistula for many years after the transplant, and it may clot. It's interesting that there are patients whose fistula will clot, and there's others who will remain open. So it all depends on your flow and whether there's any kinks or stenosis in it that may then have a lower flow because now your blood pressure is much normal than you were on dialysis. Be inspired, 15 years and creatinine of 1.1. So thank you so much, Nancy. Wonderful, wonderful, wonderful. Congratulations. And like I said, we want to remember that getting back to near normal renal function improves your cardiac function. So it's very important to, even if the kidney is not perfect, coming off of dialysis will offer you better cardiac improvement than staying on dialysis. Even if you get a kidney for 5 years, that lasted 5 years, or even 3 years, that's 3 years of improvement of your heart function, 3 years of an ability to make urine and optimize your overall status, 3 years of being able to clear some degree of the toxicities out of your body. And so even those patients who have a short-lived kidney transplant duration, they will still go back and do it again and try for something better. So just remember, this is National Donate Life Month, and so we want you to think about ways of finding a donor, getting on the list, and be encouraged. So thank you all so much for today. I enjoyed the conversation. And I see Yolanda's shouting out to Dorothy and Jennifer, and also welcoming all of you, if you're not a member of DPC, please go on the website, sign up, be a member, join the advocacy journey today, as she said, www.dialysispatients.org. Thank you all so much, and have a wonderful day and the rest of the week, and I will see you next month.